My name is Andrew Hamilton. I'm the Chief Informatics Officer and Deputy Director for the Alliance of Chicago Community Health Services. As a federally qualified community health center, we're required to report to the federal government directly. And our use of the Centricity practice solution has really been to harvest or gather that data at an individual level and then aggregate it to get a profile of our population that we serve. And that's been meaningful to drive internal quality improvement efforts, also to meet federal requirements, and more, I think importantly, to better craft our services to the patients and communities that we serve. So we do aggregate our data at a population level, and we use it to compare our outcomes to other healthcare providers that are in our sector of healthcare, other federally qualified health centers. We specifically look at core chronic conditions, so diabetes, HIV, hypertension, asthma. Those are really important conditions for us to monitor both at a local level, but ultimately, of course, at a federal or national level, as they are a tremendous impact on the cost of healthcare services, the chronically ill. We also aggregate data on preventive services, and I like to remind people that our job in healthcare is equally as important to provide services to individuals who aren't currently in that chronic illness category. And that really means providing appropriate age-specific preventive services to prevent them from getting any of those conditions that we know not only are so detrimental to their life and well-being, but also to the cost of the system as well. For example, we've been able to drive improvements in the percentage of patients that we identify as smokers that we have enrolled into a program to help them find ways to stop or decrease the amount of tobacco they consume. And that's really important. So we went from a 30% measure to over 90% within the span of 6 months, just by introducing prompts and clinical decision support in Centricity practice solution, and coupling that with the capability to aggregate that data at a population level, use those aggregate statistics to drive performance improvements in the practice setting. It's a very cyclical way in which we use healthcare IT. So for our purposes, really that using it to drive clinical delivery and best practices is by far its most important attribute that we seek and use. Working with GE Healthcare has been tremendously rewarding for not only myself, but members of our team, in the sense that we feel like we're really partnered together to find a way to develop those solutions. And how I characterize that relationship is a relationship where we listen to one another, we respect each other's challenges, as well as embrace the opportunities that we see together. And we strive always to have a transparent and open dialogue about how we can together achieve something larger than we would be able to do on our own.